Hello and welcome to this current events discussion. My name is Patrick, and today we'll be discussing psychedelic assisted therapy in psychiatry. This is prevalent in my field. I'm currently in the psychiatric mental health nurse practitioner program, and we'll be going over ethical issues with psychedelic assisted treatments in psychiatry. Basically, in recent years, new forms of therapy have been emerging outside of traditional pharmacologic medication therapy. And this includes psychedelic assisted therapies using certain substances like psilocybin or magic mushrooms, MDMA, and one of them is MDMA as well. And these particular substances have gained significant traction, showing that there are actually promising treatments for treatment-resistant depression, basically depression that is resistant to traditional pharmacologic therapy. And it's also showed that it's great for PTSD, it's also great for anxiety and other psychiatric conditions. Clinical trials even shown rapid and sometimes profound symptom relief. This leads to FDA breakthrough therapy and efforts to decriminalize these substances in certain states. But as these substances become more recognized, there are concerns about safety, regulation, and patient vulnerability, especially seen with off-market or recreational use. Essentially, the primary ethical dilemma surrounding psychedelic therapy is balancing the benefits, which have been actually reported in clinical trials, and balancing that against the risks and the very real risks of psychological harm and exploiting vulnerable individuals, especially in altered states of consciousness when they are under these sort of substances. Other issues include inadequate informed consent, so these patients may not be fully informed and fully aware of what they're going to be going under and undertaking, taking these very strong substances, and also inequalities in regards to access. Maybe these very potent and also very beneficial substances may be only used by the very rich or the people who have elite access to them, instead of the less vulnerable populations having access to them. And also this calls for the need for safeguards and policies and strict regulation when it comes to administering and controlling the aspect of how these substances are administered to the patients. Key ethical principles that are included within this developing policy regimen of psychedelics. This includes non-maleficence, as the principle of non-maleficence basically states avoiding harm to the patient. Also, the principle of autonomy. We can ensure this by truly giving informed consent, and also beneficence, basically why we do what we do. Everything we do is for the betterment of who we are serving. And honestly, this particular subject is important to me as a Psych NP student, because I believe that there are other therapies that are much healthier and that we haven't discovered yet. Right now, it's really a big, traditional pharmacologic therapy through PO pills, things like that, that has been the normal for a very long time. But with these new emerging findings and studies and clinical trials on these sort of banned substances, now they're not banned actually, now they're being used in clinical trials to help patients with psychiatric issues. I believe that there's more to discover, and there are different ways, there are alternative ways to treat psychiatric disorders, and a lot of people are actually resistant to the traditional psychopharmacologic framework that has been going on for so many years. Many people have been finding relief in these taboo substances, and so I just feel like the act of discovery and the act of expanding the mind and awareness to more taboo or unknown therapies, I think that will help many people. And people who think that they are beyond help, maybe these things will actually help them. And that can literally change a life. That can save a life from that can save money. That can save somebody from taking their own life. That can save somebody a life of pain. There are many multiple therapies to live a good and happy life. But again, these substances, these medicines carry a lot of risk. And a big thing with implementing this moving forward is informed consent. Patients need to know what they are going to be going under, and they need to be fully educated about it, because these medicines have definite risks that can negatively alter the rest of their lives. And honestly, as we move forward with these therapies, we just need to remain adherent to the code of ethics. And even in the ANA Code of Ethics, Provision 1, it states the respect for human dignity and worth, and Provision 3, the protection of patient rights, safety, and advocacy. So we need to be respectful, we need to carefully screen these patients, we need to properly educate these patients, and we need to integrate strict regulation, clinician education as well, different care models, and research on long-term effects, so we can expand safely without compromising standards or compromising policies or ethics. Very interesting topic. It's continuing to grow and to change day by day, week by week, month by month. But it's very exciting because it's very new. But again, we have to be careful, and who knows? It may be implemented, it may not be implemented. We'll see. But thank you very much for